Good morning, everyone. Welcome to episode 81 of ADHD Superpower. Today's topic is ADHD and dopamine. I previously mentioned quite a bit about dopamine, so I'm just going to jump in on the more complicated part. The definition of dopamine. The tonic level is the baseline of dopamine that's circulating in your body at all times. The phasic level or the peak level of dopamine is when you have a highly pleasurable experience. The phasic level affects the tonic level, which means the higher the baseline peak, the lower the tonic level. ADHD can cause, obviously, attention difficulty, impulsivity, hyperactivity, and they think that dopamine can definitely play a structural change in the development of the condition. Science also have been studying the role of dopamine in the development of ADHD. Dopamine is a type of neurotransmitter that has several important functions in the brain and body. There is an association between dopamine levels and several psychiatric and neurological disorders, including Parkinson's disease. Dopamine level can affect a person's mood, attention, motivation, and movement. It also regulates the brain's reward system, which its levels increasing in the brain when a person experiencing something pleasurable, such as eating food, your medication, or even having sex. Experts initially believed that ADHD occurred as a result of low level of dopamine, but they have since realized that the relationship is a little bit more complicated. According to the Gulf Band Center, people with ADHD may have a higher concentration of dopamine transporters in the brain. These transporters remove dopamine from the brain cells. When there are more transporters in one area of the brain, they do this quickly, which means the dopamine has less time to exert its effect. Reduced level of neurotransmitter serotonin and norepinephrine also contribute to the development of ADHD. There are ways to measure dopamine baseline, such as PET scan, which measures dopamine levels in the brain by comparing radio tracer binding before and after a dopamine depletion or stimulant challenge. SPECT scan, S-P-E-C-T, can measure dopamine levels in the brain by comparing radio tracer binding before and after a dopamine depletion or stimulant challenge. Microdialysis. This technique measures dopamine levels average over minutes or hours. Dopamine baseline test. The test uses PET and radio tracer to measure the effect of dopamine on the binding potential of dopamine receptors. And there are also no nanoparticles, which can be used to detect dopamine in cells or as lab-on-the-chip sensors. There is really no reliable way to directly measure dopamine levels in the brain. Blood tests can measure neurotransmitter levels, but they don't represent the levels in the nervous system. So I'm not crying, it's the win. How long does it take to reset baseline dopamine? The amount of frequency you use drugs or drink is a big factor, but most people find the natural dopamine levels return to normal level after 90 days. Many people with SUD also have underlying mental illnesses. Anxiety and depressions are common. I'm going to wipe my tears, and then I'm going to talk about this. This part for its Parkinson's disease dedicated to my amazing lifesaver, Dr. Manelli, who has Parkinson's. Parkinson's disease is a chronic neurodegenerative disorder that primarily occurs due to the loss of neurons in the I can't say that word, which is the area of the brain that produces dopamine. The reduction of dopamine in the brain can affect a person's coordination and body movement. The symptoms of Parkinson's tend to develop gradually and can vary from person to person. Doctors do not fully understand what causes the loss of dopamine-producing neurons in people with Parkinson's, but they believe that it may involve a combination of genetic mutation and environmental factor as well as exposure to specific toxin. The treatment of Parkinson's disease includes therapy that increase the level of dopamine in the brain and medication that help improve motor symptoms. Well, I hope that my doctor obviously understands dopamine. So thank you very much. Have a good day. Bye. I look ugly like this. Bleh, too early in the morning.